Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar from Ojai, California, and my clinic, Khabir's Clinic. Today, we're going to talk about natural treatments for IBS according to Ayurveda, irritable bowel syndrome, or we could just define it as continuous inflammation of the intestinal mucosa lining, particularly of the descending colon, the anus, the rectum area. Now, we're going to talk about the stages because there's different stages and different degrees of this condition according to Ayurveda. There's causes to this condition, which we're going to cover. And then, of course, there's dietary guidelines and herbal treatments that are prescribed. And of course, diet is very, very important in this condition and very tricky. In fact, it's a very tricky condition, even for an experienced herbalist. This condition can be tricky. I haven't seen anybody really been very successful on their own treating it. Many people, of course, try, and they do make progress by adjusting the diet slowly, mostly due to trial and error, which is a tough way to learn with IBS because it's a very painful condition. So the diet is essential. The diet is not what most people would consider a nutritional diet, so it's sometimes difficult for them to accept it because it's not meant to be nutritional. It's meant to be, curative and avoiding the causes and helping the intestinal lining to heal. So the different stages is first stage we can say is just inflammatory colon condition. This is where a person gets loose stools on occasion, but they don't have a history of having loose stools or diarrhea. But if they have a little spicy food, hot food, sour food, pungent foods, or citrus, for example, or tomatoes, onions, raw garlic, then they get diarrhea easily. But if they're avoiding those foods, they don't get it. We could call this the first stage where there's mild levels of inflammation in the colon, particularly the descending colon. And this is quite common. And if you treat it in this stage, it's quite easy to treat by avoiding the trigger foods and taking some very simple herbal formulas. However, most people don't treat themselves at this stage. Even a colonoscopy often doesn't show any indications of inflammation at this stage, so it's often ignored. And people don't really mind having loose stools. Maybe in the past they had a history of constipation, so they don't see a big problem. But that's the first stage. So it's important to catch these in the first stage. If you are in this early stage where you're getting loose stools, diarrhea, a little pain sometimes with spicy food, but you never had this in the past, and now you're getting loose stools, but used to be constipated. So sometimes you're getting loose and stools and then constipated stools, then you're in the early stages. And it's really very, very important to treat it quickly right then. And all the guidelines that I give you here will be more than sufficient to treat it in the early stages, particularly if you can get a hold of some of these herbs. The second stage we're talking about is, the irritable bowel syndrome, IBS, and this is continuous inflammation in the colon. And this is it becomes painful for everything that you eat, pain in almost every meal, and still can have loose stools mixed with constipation and sudden bouts of loose stool or continuous loose stool and even diarrhea. There's variations, there's types, and we're going to talk about the different types in a minute. But the main key factor is it's painful almost every meal. It's continuously inflamed. It's beyond just being triggered. It's almost every food starts hurting. And this is, of course, when people start taking it seriously. Now, it can progress to another condition where it ulcerates, ulcerative colitis, where the main sign and symptom there is bleeding. We're not going to go there, but today it's another type of treatment. Some of the foods that you can have when you have IBS, you can't have where you're having ulcerative colitis. But in fact, we can let go of these medical terms and we can just call it early stages of inflammatory bowel condition, or inflammation in the colon, we could call it, and then continuous inflammation in the colon, and then finally ulceration and bleeding in the colon. These would be the 3 stages. So must address the causes. I mean, you just don't want to take some, steroid or some medication to suppress the condition. You need to remove the causes, and this is very important. And these causes are not obvious. Some of them are very obvious and some of them are not. So let's go through. There's many causes, and of course, IBS isn't, I would say, a real disease per se. It's a combination of symptoms that are somewhat combined together to create this condition. And there's many causes. So each cause, in a sense, is another version of the condition. Because once you identify the cause, then you see that there's differences in the condition. So and from Ayurvedic perspective, there's 3 types in Ayurveda: Vata pushing Pitta, Pitta pushing Kapha, and Vata pushing Kapha. But we'll talk about both Vata and Pitta because they're usually these 2 elements. Vata, the home, is an Apanavayu in the colon. So often there's two different main types in Ayurveda we'll talk about. The first starts with Vata in the colon. So you get dry, hard stools. This is the early sign. A person can have dry, hard stools for many years and maybe taking laxatives or something to get by. But over time, then, this creates, this Vata moves out of the colon and it moves up into the the intestinal tract, and then it aggravates Pitta in the Panchaka Pitta in particular, and then Samanavayu or Vata, is aggravated. And now you have Vata and Pitta. So Vata, you have the cold, light, dry qualities, and now Pitta has the hot, burning, painful qualities combined. And of course, once you have ulceration of the colon, then we know there's even more Pitta. This is one difference between IBS and colitis, is that colitis is more Pitta dominant because of the bleeding. So the condition starts in the colon, often starts, if it's in a Vata type of case, Vata pushing Pitta, it's starting with constipation. The other type is where there's Pitta, where there's acidity, burning, and this Pitta is a Panchaka Pitta, so there's a fire, there's too much heat, there's acidity, stomach ulcers maybe, and then Samanavayu or Vata pushes this down into a Pranavayu, into the colon, and so this Pitta is entering the colon. So, and then you have this inflammation in the colon. So it's involving both Vata and Pitta. So both Vata and Pitta need to be balanced in these 2 types. So that's the Ayurvedic perspective. Causes, parasites can be one cause. Parasites can also create this Pitta and inflammation in the colon. Excess use of antibiotics. Long-term use of antibiotics destroys the intestinal flora of the the mucosa lining of the intestines, because the healthy bacteria is making up this mucosa lining. And this mucosa lining, in Ayurvedic terms, is mostly a kapha and the pitta. But the kapha is like the protection, the seal, the mucus, protecting the intestinal lining and absorbing the nutrients that are being digested by the food into the intestinal wall. So this is like a protection, this mucosa. And this mucosa, intestinal lining, this mucus, this is kapha. It's protective. So, we have high vata and high pitta, and they both are destroying the kapha from Ayurvedic perspective, and then inflaming the colon. So the antibiotics destroyed the healthy bacteria, which is one of the causes. Now, other causes, of course, are inflammatory kapha increasing foods, kapha and vata increasing foods, particularly coffee on an empty stomach. You do that for a good 20 years. You could have IBS. Chocolate, even though it has magnesium, is very inflammatory, and also hot spices, chili pepper, cayenne pepper. So we get a lot of people from Pakistan and India, with IBS due to excess use of hot spices and hot pickles. And then this damages, again, destroying the intestinal mucosa, damaging the intestinal lining, creating inflammation, and escalating, and constipation and dryness of vata, only making it worse. Other causes, of course, are vata increasing foods, such as cabbage family, cruciferous family, cabbage, broccoli, cauliflower, kale, or colon irritants due to the high amount of sulfur they have. And most raw vegetables, even salads, people who are doing all raw vegetables. I've had many cases of people who were doing raw food diets for extended period of time and came to me with even ulcerative colitis, where they had bleeding from the rectum. Too much raw vegetables, too much big beans. We call big beans because beans are aggravating to the colon. So we get gas and bloating from the skin of the beans, a an anti-nutrient, and it's a colon irritant. That's why we soak the beans first. But too much black beans, pinto beans, navy beans, lima beans, and peas, particularly if they're not well cooked. And even sprouted is worse. It's more rough. Even though they're technically more nutritious, the sprouted beans can actually be more irritating to the colon. But it's only the big beans that are the problem. The mung bean, the lentil, the azuki bean, these are fine. Even hummus. But raw chickpeas, so big beans, uncooked beans, not properly cooked beans, sprouted beans, raw vegetables, even too much raw fruit like apples that are hard and dry, coffee, chocolate, spices. These are typical causes. And other causes can be just extended lactose intolerance. I mean, mostly lactose intolerance is a digestive imbalance, but if it's not resolved over time, then this can create inflammation in the colon. Same with gluten intolerance. Generally, gluten intolerance can be resolved in the early stages because it's a digestive issue. You should be able to, have wheat in your life. I mean, there are genetic dispositions for people who cannot have lactose, but mostly it can be managed. But if it's not over a long period of time, this can create inflammation in the colon and damage to the intestinal lining. And then there's psychological aspects too that aggravate this condition and make it much worse. And particularly that's anxiety and fear, vata increasing emotions. But not to say that some pitta increasing emotions like anger, resentment can also contribute to this condition. So each individual can have different causes, and it's very important to understand these causes because your treatment will vary based on the causes, and also based on the stage that the person's at, and it will also be based on the type. And I mentioned two in particular. One is more vata type, where there's a lot of constipation and dry hard stools and occasional diarrhea. And then the other type is where there's a lot of diarrhea, maybe even 5, 6, 10 times a day, having loose stools, and there's more burning sensation. In other words, there's more pitta. Those are the two types. There's a third type, vata moving, pushing kapha, and there's a lot of mucus, but we're not going to cover this type today. We're going to cover those two types: vata type, where there's usually constipation and diarrhea mixed, and then the pitta type, where you only have loose stools and chronic diarrhea. In both cases, people can be losing weight. Both cases, people can have a lot of gas and bloating. All cases, people become fatigued because you're not absorbing your nutrients, particularly when you have these loose stools. I mean, constipation is a slow killer, and it eventually damages your colon and leads to all types of health problems, appendicitis, diverticulitis, diverticuli, and even colon cancer and IBS. These are all caused by decades of constipation. But once you have the inflamed colon, then you're going to be fatigued because you're not absorbing the nutrients. You're going to have pain, and you're going to have weight loss. So a lot of times people are coming in, they've already lost 20, 30 pounds by the time they come in. Unfortunately, most people always come in when it's quite severe and they've, quote, tried everything, unquote. So, but they're unaware that just having salads can make it worse. Having many beans can make it worse. And in fact, we're going to talk about the diet, just eating even meat, even though it's not a cause, that generally we don't have any meat at all. And in fact, we have more dairy unless there's lactose intolerance. And even if there's lactose intolerance, we want to do ghee, which has no lactose. So a lot of times people are doing raw diets with a lot of vegetables and no dairy and no fat. So this is creating the vulnerability for this type of inflammation in the colon, because it's a low kapha, low fat diet, and there's nothing coating the intestinal mucus, intestinal lining. There's no prebiotic for the bacteria to live. You have, some antibiotic treatments on top of that, and then you have the recipe or the conditions for inflammatory colon condition. And it's very tricky because once you have it, it's very difficult to heal it, particularly if you're not aware of what diet and what foods is making it worse, which is the case of every single case that I've ever had, where the people were always having the foods that were not allowing it to heal. Most cases that I've had, people have had it for years before they came to see me, unfortunately. 2 years, 3 years, 5 years, 8 years. You can see on my website, I have testimonials from many people who have had it for a long time. I even have one testimonial from a medical doctor himself who was treating it through medical means, being a medical doctor, going to specialists. And this went on for years and years. And then he says in his testimonial to me that his pain subsided within days, diarrhea subsided within weeks, and he felt completely healed within 1 month. So, but you have to have a good patient. You have to have a patient that's following the instructions. And if you are my patient for IBS, I've learned from experience to, prep the client to follow the diet and not deviate, because it seems like everybody does. They all deviate from the diet. And we're going to go over the diet next. But the diet is somewhat hard for people to get their heads around because it's not a nutritious diet. And maybe they just think sprouted beans are the best thing in the world, raw vegetables are the best thing in the world, and they have this in their head, and this is the cause. Or maybe they don't want eat any dairy, and that's even making the condition worse, when in fact having ghee will actually help improve the condition. I tell people that imagine you had like a big, a rug burn on your arm, and it was not quite bleeding, but it was exposed raw. And then you would, if you put butter on it, it will feel good. Well, that's why butter is good for IBS and irritable bowel, is because it's soothing, it's coating, and butter and ghee becomes a prebiotic. It becomes the environment for the healthy bacteria to populate and grow and to replenish and to protect your intestinal lining. So people doing low-fat diets, no dairy at all, can make the condition worse. And they get a little confused because milk will generally make it much worse. Well, ghee feels good. So, often people, we just generalize and we just say, oh, dairy's bad. When I have milk, it hurts. So they stop everything. So this makes it worse. And then the people are losing weight because, they're not able to absorb the nutrients. Like I said, constipation's a slow killer, but diarrhea, loose stools can really drain you very quickly and make you lose weight very fast and have extreme fatigue. So the quick killer and is diarrhea. So it's more severe when there's severe diarrhea. You're not getting nutrients. You're becoming dehydrated. You're becoming weaker and weaker. So the diet. And of course, it depends on which of the two types you have, whether you're dry and hard constipation, alternating with occasional diarrhea, or just chronic diarrhea. But if you have chronic diarrhea and loose stools, or just a lot of abdominal pain, the main grain we provide is a white rice, white basmati rice, because the husk of the colon, of the rice, is an irritant to the colon. When you have, particularly if you have ulcerative colitis, where it's even worse, and for sure we're using only white rice because the husk of the colon can irritate. The husk of the grain, in this case brown rice, will irritate the colon. Even the little seeds on top of a strawberry will irritate the colon once it's a severe case. Even sesame seeds and sunflower seeds have little sharp points on them. They will create more bleeding and pain in a severe case. But in a minor case, they may not. So you don't want to make the diet too extreme. You should match the stage that the client's at. You shouldn't just give yourself or anybody an extremely restrictive diet in any case if they're not severe and you can get away with using brown basmati rice, then do so. But overall, it's safer, the white rice, particularly if there's loose stools and diarrhea. And we have to have some protein. So generally we do yellow mung dal. Yellow mung dal, not the green mung because it has the husk again. Yellow mung. It's high in protein, easy to digest. If the case is not too bad, you can use some lentils, you can use some azuki beans. Tofu is also soft and gentle. So there are a few little exceptions there. Almond flour is also proven to be non-irritant, even for severe conditions. And you can buy like some types of a bread made from almond flour. So generally put them on a white rice or brown, yellow mung dal, and then very cooked vegetable, well-cooked vegetables. Of course, you don't want to do anything hot, no chili pepper, no cayenne pepper, not even, depending on the degree, not even too much black pepper. It depends on the degree. If it's bleeding, then you're down to fennel and coriander. Even if it's very serious, you can't even do turmeric. Turmeric's related to ginger. It's heating. If there's a pitta condition, turmeric can technically make it worse. And we've seen people just try to take a lot of turmeric and take care of this problem. And maybe in early stages, it won't be harmful, but in later stages, it's actually making the condition worse. So it's a very tricky condition. You have to be very sensitive to the stage the person's at, understand what the causes were, and adjust the diet accordingly. So I'm giving you this diet in general terms, but there's no spices, no hot spices, and also no cabbage family, no cabbage, cauliflower, kale, Brussels sprouts. These are all gone. And in fact, raw kale is a cause. I know there's many t-shirts that say I love raw kale, but you might as well put in fine print under the bottom of that t-shirt, but it does lead to IBS with excessive raw kale eating. I've seen it, here in California. And also no tomatoes, nightshades, tomatoes, eggplants, bell pepper. These also make it worse. And a lot of people have figured that out by the time they've come to me. There's more tricky aspects of the diet. Those are the two obvious ones. Of course, it's also obvious: no coffee, no chocolate, no alcohol. See, alcohol is very sharp and light and hot and penetrating. It's like the worst possible thing. In fact, it's probably a cause, just like stomach ulcerations can come from hard liquor. A person who's had stomach ulcerations in the past, is a very, is a candidate for this type of ulceration and inflammation later in the colon. These hot spices, these raw vegetables, coffee, chocolate, all need to be avoided. And all the vegetables need to be well cooked and soft. There's nothing hard. You put nothing hard. You don't have raw carrots. You have carrot soup. So everything must be soft. Sweet roots, carrots, sweet potatoes are good. Squash, zucchini, pumpkin is good. There's no salads in this diet at all. No roughage, no raw vegetables. And even spinach can be an issue at some level. So it's a fairly restrictive diet. It's not the most nutritionally sound, but you generally want to get rid of the condition as quick as possible. And the diet itself doesn't heal it. This is a very important point. I'll repeat, the diet won't heal it. All it's doing is preventing it from not getting worse. I mean, having squash and zucchini isn't going to heal your intestinal lining, but it may feel better. You don't have the pain. So sometimes people, after years of suffering, trial and error, years of Google research, they've discovered that if they eat white rice and cooked soft vegetables, they have no pain. But as soon as they deviate from that and have a salad or anything else, then they immediately have pain, and they can stay like this for years. And of course, they're losing a lot of weight, getting very weak. And then what people tend to do is they want to have meat because they're losing weight. Chicken, beef, pork, lamb, fish, meat, different forms of meat. But this, even though it's not a cause having the meat, it doesn't allow it to heal. So then the people, because they feel so weak and hungry, they go to the meat. So they start having, and meat doesn't seem to aggravate it much. So they eat the meat, they eat the soft cooked vegetables like sweet potatoes, squash and zucchini, and cooked carrots. And maybe they've discovered white rice as well. Most people don't discover the mung dal, so they're not getting enough protein. Then they go to the meat and bland like chicken soup. But then the meat doesn't allow it to heal. So now you're stuck eating this meat and cooked vegetables and white rice. But as soon as you deviate from this, the slightest bit, you're back to the pain, the diarrhea, the loose stools. And I've seen people in that stage for years before they came to me. So you really have to have the herbal treatment as far as I can see. I think that if a person followed the right diet for long enough, like the mung beans, the rice, the soft cooked vegetables, very mild spices, coriander, fennel, maybe a little turmeric, maybe a little cumin, depending on the condition, I think slowly it would heal, slowly. But, it's hard. You don't want it to heal slowly because it's hard to live off of that diet for very long. But if you add meat, then it doesn't heal quickly. And if you go have some coffee, some chocolate, then it can aggravate very fast and you can go right back to square one. So a lot of people make a little progress on the diet and then they relax or they get tired of it. And then they go have some chocolate, some coffee, something else, and then it triggers and they go backwards. So I say almost every client that I've had that's been on this did the 2 steps forward, making good progress, and then something happened. They either got too relaxed and confident and ate the wrong foods before the intestinal lining healed, or they just weren't taking the herbs that were going to help it heal, and then they go backwards. And then they go this forward, backward, and this can go on for some time, and it's quite confusing and frustrating for the patient. So herbs tend to speed it up, and like the medical doctor said in his testimonial, in 1 month it can be treated. But fortunately, the medical doctor was a good patient. He followed instructions, and he recovered very quickly. Not everybody does. No, most people are dragging it on for months, 3 months, 6 months, even a year. But by the time they finish, they look back and they realized, yeah, they shouldn't have ate the meat. They went and had coffee a few times. And, each time they did one of these things, it set them back. So let's talk about some herbs. First of all, we just want to bring down the pain. So we made a formula, a tea here for this condition, made of demulcent herbs, many of which are easily obtainable. And we'll start here. We call it soothing gut tea. Soothes the stomach lining. We also give it for stomach ulcerations, coats intestinal linings, used for, ulcers. And it's also prebiotic. So it's creating the environment for the healthy bacteria to live. And if the person has been done a lot of antibiotics, then we give them this, plus they need to take probiotics. And you can see the ingredients there: marshmallow root, slippery elm, comfrey root, which, comfrey, if you're familiar with comfrey, it's healing joints, healing wounds, healing guts, and licorice, which is a demulcent, which also has some antiviral qualities. But the marshmallow root and the slippery elm is the demulcents that it coats the entire lining, and this is why it's very effective, and that's why we call it soothing gut tea. So this is often given if there's acid reflux or heartburn involved. Then we have to give a calm belly tea, and this reduces abdominal pain, inflammation, heartburn, acid reflux. And it's these alkalining type of herbs like alfalfa are in here, and a cat's claw is anti-inflammatory, meadowsweet's, anti-inflammatory, cooling, nervine, chamomile's anti-spasmodic, and there's marshmallow root, which is also demulcent, coating the intestinal lining. So it's just for a slight variation. If there's burning, acidity, we give that. If there's not too much pain, but we do want help the digestion, because there is it's a digestive problem. The food has to be digested very well. That's why we want all soft, warm foods, no dry foods, no hard foods, no spicy foods. You need to chew your food well, and it should be so we want to support the digestion. So even if the condition isn't too painful, there's no acid reflux, we'd still provide at least a very mild digestive tea like this one, made of coriander, cumin, and fennel, which we've stone ground. So they're very not powder and not whole, but crushed. And this is, taken during meals, and it just helps strengthen the digestion. So there'll be one of these teas provided to help and strengthen the digestion. And then if there's a lot of loose stools and diarrhea at night, we may give psyllium husk. Psyllium husk, with a little water at night, can help firm up the bowel movements and slow down the transit time. If there's a lot of diarrhea, then we really need to stop the diarrhea as quickly as possible. And in Ayurveda, the main herb that we use for diarrhea is called Bilva. And Bilva is a astringent herb that is tightening up the tissue and is preventing the diarrhea. Now, of course, there's some conditions where you don't want to stop the diarrhea, or not too quickly, but in this condition, we have to stop it. So we have a formula for this if it's necessary. We may give them psyllium husk at night and the diarrhea formula. And you can see the first ingredient is Bilva. And Katuj is probably the best herb for IBS. Dadimastica terna is actually made from pomegranate skin. It's also astringent, good for diarrhea. Kamaduda is bringing down heat. This is another formula. Laja Lut is also for loose stools, and it's a demulcent. And Arjuna helps the tissue heal. Arjuna is known for helping the tissue heal. And then a Shank Basma is made from the shell of a shell, powder of a shell. And it's lowering pitta, heat, and it's a little constipating. So this diarrhea formula would be taken at night with some psyllium husk, often together, to immediately stop the diarrhea. And it has to be adjusted because you don't want to be constipated. Like I said, the best herb, though, if there's not a lot of diarrhea, is Katuj. And in India, they give you what's called Katuj Vati. And it's just Vati means capsule, so it's Katuj capsules. This would be given anybody in India. You have IBS, they're going to give you Katuj. If you have diarrhea and loose stools, they're going to give you Katuj with Bilva. We've just put them in a formula together. And then if there's bleeding, like in ulcerative colitis, then we add a special herb that helps with bleeding called Nakashar. And there's also Indian formulas that are based on Nakashar. It's also used for excess menstrual bleeding and also ulceration bleeding. Any type of bleeding, we're using Nakashar. So that could be added. If there was diarrhea plus bleeding, then we would add, Bilva, Katuj, Nakashar. There's heat and acidity, Shankabasma, Arjuna to help the skin heal. So that would be our first line of defense, after changing the diets to stop the loose stools. And then here we have a formula that's given before the meals. We call it, diarrhea and IBS formula. So the person has loose stools or excessive bowel movements, but this one is given before the meals. So we're helping with absorption, and it's made from Dadimastica, which is this formula that I just mentioned. That its main ingredient is the skin of the pomegranate, and it's got sugar cane in it. It's very sweet, It's got a little cumin in it, and it's helping with the digestion. You just take a little bit before the meal to make the digestion strong, and then afterwards. Sometimes we give it even afterwards too, but mostly it's given before the meal, and we use some other herbs after the meal based on the state of the digestion. But this is our most common formula for IBS, and that's why we called it Diarrhea and IBS Formula. But it's based on the traditional Indian formula called Dadimastika. There it is, Dadimastika. It's a bunch of herbs in there. And this is if you're in India and you have IBS, they're going to give you Dadimastika. They maybe give you Katuj capsules, maybe give you Bilva capsules, may give you some psyllium hosket night. These are all traditional Indian approaches. We've just made formulas. If there's a lot of pain after the meal, a lot of abdominal pain, then we use this formula here, particularly if there's abdominal pain and ulcerations. And this is, Guduchi is a premier herb in Ayurveda. It's also called Amrit, and this is balancing Vata Pitta Kapha. Mostly it's anti-inflammatory. And then Shank Basma is made from the shell, powder of the shell. So this is very anti-inflammatory and calming. It could be used for acid reflux, stomach ulcers, even more serious conditions in IBS, and it gives instant relief. So we may give, for example, the IBS formula, a half a teaspoon before meals to help the digestion be strong. And then after meals, give the Shank Basma with Guduchi to, to soothe the intestinal lining. And then in between meals, they could be having the soothing gut tea between the meals. And then maybe at night, they're going to have a little bit of the diarrhea formula. And you have to adjust the herbs as they're making progress. Once you have the condition under control, then, we can start to change the herbs as the person's progressed. If they don't have diarrhea, but just loose stools, then often we'll give them this one here. We just call it Pitta colon number 1. And it's a very simple formula. It's mostly Buma Malaki. But you can see it's got the Katuj in it, and it's got Amla, which is anti-inflammatory, and it's got very soft, mellow herbs like fennel and licorice, which are demulcents. But the main ingredient is Buma Malaki, and this is for, as it says, intestinal inflammation and loose stools. The Buma Malaki and the Amla for the inflammation, and the Katuj is for the loose stools. So it depends on the individual. When they first come, they could be taking the diarrhea formula. The next appointment, they may be taking just the Pitta colon formula. That will just help with loose stools. As the condition progresses, the herbal treatment needs to also progress with the condition as it's getting better. Now, finally, once we get the loose stools under control, the digestion under control, and the person's starting to gain weight back, they're not having pain, then we need to heal the intestinal lining, which we have a formula here just for this job because we have a lot of cases. There's called with nice clear name here for you, Healing Gut Formula. And there's the Katuj again. See, Katuj is in every one of these formulas. It's the premier herb. There's Bilva too. So it's just not as much. The amount of Katuj and Bilva has just gotten reduced. But Arjuna is the first herb because now we're trying to heal the tissue. And Bala means strength. It's also a good healing herb. Kamaduta is an anti-inflammatory, pitta balancing one for heat and burning. Lajalut is another not commonly used herb, but it's very demulcent and also coats the intestinal lining. So then they start to just do the probiotics with the healing gut formula and the soothing gut formula, and maybe they're taking a little something at night. But meanwhile, they're staying to the mung beans, the soft cooked rice, no chili pepper, no cayenne pepper, no chocolate, no meat, no chicken, no fish, no lamb, no pork. I have to repeat this many times because people, they don't tend to get that part of it. And a lot of times people feel better within 2-3 weeks, and then they just relax and then go out to eat at a restaurant, and the whole thing gets worse. Or we have many cases where people completely recovered, gave me the testimonial, thanked me, everything, and then 2-3 months later, they called back and reordered all herbs again, or said they need a follow-up because they went back to the same old habits of having chili pepper, coffee, chocolate, raw vegetables, and large beans and aggravated their colon again. I mean, just like any condition, once you've had it once, I mean, you always will be a little susceptible to have it a second time. So you have to, be careful for some time. So I've had many cases that are just reoccurred, 3 months later, 6 months later. And often it's because they just changed their lifestyle. They forgot they ever had IBS, and they were feeling so good. And even they were having a little chili pepper and other things, but they just relaxed too much. And of course, once the condition improves and you're fine, which really you should let the practitioner decide, not yourself, then you'll be able to go back to eating, animal products. And just a few more notes on the diet. Generally ghee is encouraged. Also, buttermilk is encouraged. No, milk is not encouraged. Wheat is not encouraged. White rice is what's done. Wheat is too rough, particularly whole wheat bread with a lot of seeds and hard pieces. This is not encouraged. So we just want that white, mushy, soupy rice, soupy lentils, soupy mung beans, steamed, well-cooked vegetables, squash, zucchini, pumpkin, asparagus, cooked bok choy. Everything is very soft. Sweet potato with butter, and there's better ghee because there's no lactose. So there's a lot of ghee, and it's a building, strengthening diet. Sweet potatoes with ghee, a lot of rice, mung beans. So people need to stop losing the weight, start gaining the weight back, and then once they recover, if they're depleted and very underweight, then we can put them back on more animal protein. Aloe vera can be a problem in the very beginning, but in later stages, it can be beneficial. But you should never get whole leaf aloe vera. You should always use inner leaf aloe vera, because a whole leaf has the skin, and the skin is an irritant. So many people tried this, having aloe vera when they're having IBS, and it can make it worse. It's a laxative, particularly the skin. But in the later stages, once you're recovering and it's starting to get better, inner leaf aloe vera can be very helpful. As we know, aloe vera helps tissue to heal. But generally, we don't use it because it can be a problem, particularly in the early stages. So very tricky condition. Diet's very tricky. It needs to be adjusted. People need to stick to the diet for a couple months. And any type of deviation from the diet, particularly something extreme like chili pepper and salsa and restaurant food, can set you back a whole month in the treatment. And just about everybody has done that I've known, that I've dealt with and counseled and treated, has deviated too soon from the diet because they were feeling better, and it sent them back a month. Many people right back to square one, doing an appointment again, reviewing the diet, getting all the herbs again, and starting over. But after they've done this about 2-3 times, they get very good at it, almost like expert. And I've had people who know more about IBS than I do because I treated them 3 or 4 times for it, and I learned from them too. Like one client, I did learn that the almond flour felt quite good, and I've told that to other people. They made almond flour muffins that are good. Egg whites seem to be a problem. Sometimes eggs are okay. You just have to go person by person. But you have to get the inflammation under control. You have to get the diarrhea under control. You have to maintain the diet for some time, and then take the herbs that start to allow the intestinal lining to heal. And if you've had a lot of antibiotics in the past, then you have to take probiotics as well during the treatment. And it can take it should only take a month, but in most cases it's taking 6 months, because this 2-step forward, 1 step back, 2 step forwards, 1 step back. But generally, by the time they've done this about 3 times, for most people 3 times, they're tired of that. They know the diet now. They know what went wrong, and they know how to take the herbs. So they're very good at it the 3rd time, and they generally stick it out. So it takes most people about 3-6 months to resolve. So again, if you have such a condition, I encourage you to make some dietary changes that are obvious, and make at least that progress. You can't eat out in restaurants. You can't eat food outside. Everything has to be home cooked. And this is quite challenging for people as well. So you could do that right away. Start cooking at home, eliminating the obvious foods, and then you would need a good practitioner with experience with this condition to further allow your intestinal lining to heal, so you wouldn't have to stay on this restrictive diet forever. So I hope that helped you. I hope it gives you hope. And of course, ulcerative colitis is a more advanced condition with more bleeding. There's ulceration. So the diet's more strict, and there are other herbs to help with the bleeding. But it's a progression of the same condition from the Ayurvedic perspective. And if you're in the early stages and you're just getting loose stools and diarrhea sometimes every time you have a little spicy food, then you should also consider having this looked at or setting an appointment with myself so we can address it in the early stages, this inflammation in the colon, before it progresses, because once it progresses, it's hard to reverse back. So once again, I hope this helped you. And this is, of course, the Ayurvedic perspective. I'm educating you on what's been taught to me by Ayurvedic doctors in India. And if you have any additional thoughts or input on what I've said, or you want to correct or add to what I've said, please feel free to add this in the comments. And I look forward to hearing from you and helping you in the future if you have such an inflammatory colon condition. Thank you very much.